Reading electrocardiograms, ECGs or EKGs, and identifying common arrhythmias is a valuable skill for healthcare professionals. Let's break down the process into steps. Part 1. Basics of EKG Interpretation. Understanding the EKG paper. 1. EKGs are recorded on paper or displayed digitally. 2. The paper has small and large squares. 3. Each small square represents 0.04 seconds, and 5 small squares make up a large square, 0.20 seconds. Placement of leads. 1. The standard EKG has 12 leads, including limb leads. I, 2, 3, AVR, AVL, AVF, and precordial, chest, leads, V1 to V6. 2. Leads provide different views of the heart's electrical activity. Components of an EKG. 1. P wave, represents atrial depolarization, contraction. 2. QRS complex, represents ventricular depolarization, contraction. 3. T wave, represents ventricular repolarization, relaxation. 4. PR interval, measures the time from atrial depolarization to ventricular depolarization. 4. Normally, it's 0.12 to 0.20 seconds. 5. QT interval, measures the time from ventricular depolarization to repolarization. 5. It varies with heart rate. 6. ST segment, represents the early ventricular repolarization. Part 2. Identifying common arrhythmias. Normal sinus rhythm, NSR. 1. This is the standard rhythm of a healthy heart. 2. Characteristics. Regular rhythm. P wave before each QRS complex. Normal PR and QT intervals. Heart rate typically between 60 to 100 beats per minute, BPM. Atrial fibrillation, AFib. 1. Characteristics. Irregularly irregular rhythm. Absence of distinct P waves. Instead, you see rapid, irregular fibrillation waves, F waves. Normal QRS complex duration. Heart rate varies. Atrial flutter. 1. Characteristics. Sawtooth pattern of flutter waves, F waves, between QRS complexes. Usually regular rhythm. Heart rate depends on the ratio of F waves to QRS complexes. Ventricular tachycardia, VTach. 1. Characteristics. Wide and bizarre QRS complexes. Regular rhythm. Heart rate usually over 100 BPM. Ventricular fibrillation, VFIB. 1. Characteristics. Chaotic rhythm with no discernible waves. Irregular. Medical emergency requiring immediate defibrillation. Supraventricular tachycardia, SVT. 1. Characteristics. Narrow QRS complexes. Regular, rapid rhythm. Absence of visible P waves. Ventricular premature complex, VPC or PVC. 1. Characteristics. Wide and bizarre QRS complexes. Often followed by a compensatory pause. Atrioventricular, AV, block. 1. Characteristics. First-degree AV block, prolonged PR interval. Second-degree AV block, intermittent absence of QRS complexes. Third-degree AV block, complete heart block. No relationship between P waves and QRS complexes. Sinus bradycardia. 1. Characteristics. Normal P wave preceding each QRS complex. Heart rate less than 60 BPM. Sinus tachycardia. 1. Characteristics. Normal P wave preceding each QRS complex. Heart rate greater than 100 BPM. Practice and resources. 1. Regularly practice interpreting EKGs using textbooks, online courses, or EKG simulator tools. 2. Seek feedback from experienced healthcare professionals. 3. Stay updated with the latest guidelines and research in cardiology and EKG interpretation. Remember that EKG interpretation is a skill that improves with practice and experience. In clinical settings, always consult with experts for accurate diagnosis and patient care. Consider formal training and certification for in-depth knowledge and patient safety.